Were you aware that you can no longer contribute into a health savings account once you enroll in any part of Medicare? That's right, it's a no-no with the IRS, and it could get you a tax penalty if you get caught doing it. Hi, if we haven't met yet, I'm Danielle Roberts, co-founder here at Boomer Benefits, where we help baby boomers navigate Medicare and select suitable supplemental coverage. In this video, I'm going to explain why HSA plans and Medicare do not play well together. We'll cover why you can't contribute to an HSA while you're on Medicare, when you should stop contributing and enroll in Medicare once you near retirement, and whether your spouse can continue to contribute if he or she is still working, and more. Stay tuned to find out how you can get our free HSA planning worksheet that will help you avoid any missteps. Today we have many Medicare beneficiaries who work past age 65 at large companies. Some are enrolled in high-deductible group health insurance plans through their employer, and these plans are HSA compatible, which means that the insurance gives you the opportunity to open a health savings account which you can use to save for future medical expenses. As a licensed insurance agent, I'm quite familiar with HSA plans and how they work. In fact, I have one myself, and I really enjoy the fact that I pay no taxes on the money that I contribute into my account each year. I'm also a huge fan of people using them to save up a nest egg of money for medical expenses in retirement. Here's my reasons why. Once money goes into the account, that money is yours forever. It compounds interest over time, and you can use it later to pay for medical expenses in retirement, including Medicare premiums, deductibles, copays, and coinsurance. In fact, once you are 65, you can even spend the money you've saved up in your account for non-medical expenses, and you'll incur no penalty, just ordinary income tax. So your high-deductible health plan gives you the opportunity to contribute to an HSA, but only if you have no other medical insurance, and unfortunately that includes Medicare. Enrolling into Medicare Part A or any part of Medicare makes that contribution illegal, so it's important that employees with health savings accounts look carefully at the rules for contributions into their HSAs, which we'll cover next. Most Medicare beneficiaries who are still working at age 65 choose to enroll in Medicare Part A. That's because Part A costs nothing for most people, and it could reduce your hospital spending if you ever have an inpatient stay. However, Medicare Part A is a form of health insurance, and as I stated earlier, the IRS does not allow an employee or their employer to contribute into an HSA if the employee is enrolled in any other insurance except for the employer high-deductible health plan. If you want to contribute into your health savings account after age 65, you should not enroll in any part of Medicare. Then you will continue to be able to make those contributions tax-free. You'll simply postpone applying for Medicare until you decide to retire. There's no late penalty for Part A or Part B if you maintain creditable, large employer group health insurance that is primary to Medicare. Here's something else. Be aware that if you enroll in Social Security income benefits, you will trigger Part A automatically. You cannot collect Social Security income benefits without having Part A, so it's important that you don't enroll in Medicare or income benefits until you're ready to stop contributing into your HSA, which for most people is shortly before they retire. Now, what if you didn't realize this and you've already signed up for Part A on Social Security income benefits? If that's the case, just stop contributing to the health savings account at this time. Do not attempt to cancel Part A that is already in force. This can have dire consequences to your Social Security income benefits. You cannot cancel Part A after beginning your Social Security benefits. If you do, you'll have to pay back the money you've already received from the federal government. Instead, you can just use the funds that were already in the health savings account toward your Medicare Part A, B, and D premiums, as well as copays and coinsurance. Funds can also be used for ordinary approved medical expenses such as doctor visits, lab work, dental and vision costs, and even prescription copays. Also, if you have a spouse who's not eligible for Medicare on the high deductible plan, your spouse can still contribute up to the family maximum in his or her name. The contribution just can't be in your name. For more rules about HSA contribution, visit the IRS website. So what should you do if you've postponed Medicare to continue contributing into your HSA and now it's time for you to retire? You'll want to plan for when you'll enroll in Social Security income benefits and then stop contributing into your HSA 6 months before you apply. The reason for this is that when you apply, you will automatically trigger your enrollment into Part A and Social Security will make this retroactive for 6 months. This means that you need to have already stopped your contributions during those months. Now let's talk about Part D benefits that you'll need after you retire. Some high deductible health plans do not have drug coverage that is considered creditable for Part D. In other words, the high deductible insurance plan will not pay as much as the standard Part D plan would. If that's the case, your employer is responsible to send you an annual Medicare Part D notice prior to October 15th. They must advise you that your drug coverage is not creditable for Part D. If you receive a notice like this, it means that later when you enroll in Part D, you will likely owe a late penalty. Part D penalties are assessed at 1% of the national average Part D premium per month for every month that you could have been enrolled but were not. At just 1%, it's a small penalty, but it's cumulative. So if you postpone Part D for several years, it can really add up. You will also pay the penalty for the rest of your life, so it does need to be considered. You should work with a licensed Medicare insurance broker to help you calculate the potential penalty. Then make your own decision on whether it is still best to delay enrollment into Medicare so that you can continue to contribute into your HSA account. We realize that these rules can be confusing and sometimes just downright mind-boggling. That's why our team of Medicare insurance experts here at Boomer Benefits are here to help guide you. Be sure to grab our HSA and Medicare worksheet in the notes below this video and give us a call so that we can help you consider all the moving parts. You should also consult your tax professional about your HSA contributions to receive guidance on the financial end of things. Thanks for watching, and we'll see you in the next video.